Surgery, I think, still very much has a place in aesthetic practice, and I think one of the really good developments recently is that we're no longer saying you must have surgery and that's the only way, and we're actually now working out how we can work alongside the non-surgical modalities out there, how we can work alongside our non-surgical colleagues in really synergistic ways, which I think is a really, really healthy development. It's no longer this either or that as it used to be perhaps in the bad old days. Surgery very much has a role. There are certain things that you just can't do, without having surgery. A breast enlargement is a typical example. There is no way of increasing the size of breasts without undergoing surgery of some sort. All of the non-surgical alternatives that have been tried out there, in my opinion, don't really work in terms of increasing the size. But however, a good non-surgical colleague will be able to advise in terms of tightening up the skin perhaps to maybe improve the shape of the breasts. Similarly, when it comes to the face, rhinoplasty is a good example where non-surgical and surgical can exist side by side and work really well together. Non-surgical rhinoplasty, I think, is really coming of age, and a good non-surgical rhinoplasty doctor will be able to do amazing things without you undergoing a full operation with someone like me. However, there are limits. A rhinoplasty can't make a larger nose smaller. Whatever a non-surgical rhinoplasty does, it will effectively increase the nose, but it is hiding those. It's creating the illusion of a better shaped nose that fits your face better. But surgery quite often is the best method for correcting some of these issues. If you have a very big bump on the nose, surgery really is the only way to reduce that down in a meaningful way. If you have a very big tip or very wide nostrils, then I think it really is only surgery that can achieve that. Having said that, don't be put off by surgery because, it's scary or it's, something to be, frightened off by. At Cadogan, we're doing day surgery on almost all of our procedures now, with patients coming in and out on the same day. We are doing them under a general anaesthetic with patients, having things done really very, very safely and going home actually feeling pretty good, and resting up in the comfort of their own beds rather than having to spend, nights in hospital as a patient.